Hi everyone, my name is Rochelle J. Vendra, and today I'm going to be talking about our QI initiative, which is improving sepsis care in a community hospital. So, for a little bit of background, sepsis is a leading cause of hospitalization and death globally. The Surviving Sepsis campaign aims to reduce mortality through a multidisciplinary approach to improve sepsis outcomes with standardized treatment protocols and time-specific care bundles. Through this, we can prevent errors, delays, and variation in care across different hospitals or even individual healthcare teams. Although sepsis bundles are available, data from our community hospital exhibits low adherence, with the bundle being reported to be used as low as 3% of cases. Given this data, our aim is to achieve 70% compliance with sepsis bundle protocols over the next 12 months, so we can focus on making a significant impact on patient outcomes and set a new standard for care excellence. A root cause analysis was created so we could identify the factors that lead to missing compliance. When we talk about healthcare staff, the inconsistent use of sepsis protocols by different physicians or specialties can play a role in missing compliance, whether it be the ED team, the rapid response team, or the internal medicine team on the floors. Failure to follow up with nurses and other healthcare teams about sepsis status also play a significant role in missing compliance. When we talk about education, lack of consistent ongoing education and updates about sepsis treatment protocols, or even nursing education about vitals and sepsis time intervals and when to follow up, can lead to missing compliance. When we look into systems, ineffective EMR alerts and reminders for sepsis bundle compliance can play a role in missing compliance as well. And when we talk about resources, delays in obtaining test results, whether it be blood cultures, lactate levels, and insufficient access to specialized staff for timely decision-making do lead to missing compliance as well, and should also be considered. When we talk about patient factors, late presentation of sepsis or failure to recognize early symptoms by patients or caregivers, or even comorbidities or underlying conditions make it difficult to adhere to sepsis protocols. When we talk about communication, poor handoff communication between shifts leading to missed sepsis interventions and unclear updates on patient status and patient progression also play a role in missing compliance as well. A quality improvement project using the IHI model was launched to improve sepsis care. A multidisciplinary team, including ER physicians, IM residents, nurses, pharmacists, and EMR representatives, were brought together to hold monthly sepsis meetings to dedicate time to conducting thorough root cause analyses and collaborating together to develop targeted system improvements to enhance sepsis care. Of our 3 overall PDSA cycles to date, the first 2 PDSA cycles were implemented to test and refine changes. In the first cycle, we focused on delivering comprehensive education regarding sepsis guidelines in general. And then in our second cycle, education was enhanced with a workshop which featured case scenarios and an interactive Q&A session to deepen understanding while also addressing any specific concerns and get feedback as well. In our third PDSA cycle, the team delivered an educational session that focused on the sepsis bundle itself and the positive outcomes associated with the standardized sepsis orders. Residents also received comprehensive education on sepsis outcomes, protocol gaps, and the best practices through a series of targeted conferences. Additionally, residents were also trained on the importance of accurately documenting adherence in the EMR. Monthly sepsis meetings have also continued to be in the schedule. As we can see here, we have tracked the data over the last 12 months at our community hospital in regards to our sepsis bundle compliance. Since February 2024 to 2025, we have been taking the information down and trying to see how compliant we are and if we're reaching our target. We can see in May and June we are missing data, however this is when the EMR system was down. Of note, we can see that there's multiple periods during the year where we have achieved about close to 70% compliance or even greater. While there are peaks in our calendar year where we do reach the targeted rate of 70% or even greater, when we take the 12-month rolling average, we are still below our targeted rate of 70% in terms of compliance. So while we have come a long way from our original 3% compliance rate, there is still room for improvement and ongoing education as well as feedback as well. Through our QI initiative, we've been able to create an alignment with hospital priority. We've also been able to establish a relationship between residents and hospital staff to help improve sepsis outcomes. And most importantly, we have improved sepsis outcomes via continuous education, order set compliance, and culture change regarding sepsis care. Residents have also been able to focus on early recognition, documentation, follow-up importance that can help improve sepsis outcomes. Improving sepsis outcomes by utilizing the Surviving Sepsis Campaign guidelines provide us with the tools necessary to reduce overall mortality from this condition. So, for our next steps, we plan to meet monthly, reevaluate the root cause analysis, and incorporate education that may lead to improvement in sepsis care. We will also be collecting data and studying the data following each intervention, and how improving adherence using the sepsis bundle order set will affect adherence to sepsis protocols as well. And finally, the team recognizes a need for clear documentation regarding time-sensitive follow-ups and the importance of system interventions. Right now, we do have a template for physicians to utilize in performing and documenting follow-up that we hope to incorporate and instill here in the future. And that is all for our QI presentation. Thank you so much for listening.